My name is Bill Moss, and on behalf of the co-organizers of this symposium, Professor Brian Greenwood and Professor Diane Worth, I welcome all of you to this symposium celebrating World Malaria Day. World Malaria Day was established in May of 2007 by the World Health Assembly. It was initially, the first event or day was in 2008, and it built upon Africa Malaria Day that had been established back in 2001. And the reason we celebrate World Malaria Day on April 25th is because that was the day the Abuja Declaration was signed, committing countries in Africa to reduce the burden of malaria. The global theme of World Malaria Day this year is Zero Starts With Me. And there are two messages, I think, in that soundbite. One is the focus on zero, which is an aspirational goal to rid the world of malaria. And the fact that it starts with me, meaning that all of us, from local communities to politicians to key global stakeholders, and academic researchers are part of this process of helping us move toward a world without malaria. Our theme on malaria elimination in Africa kind of builds on the global theme of Zero Starts With Me and also follows the historical development of World Malaria Day, starting with Africa Malaria Day. We all know that we've made the global community and countries, particularly those in sub-Saharan Africa, have made great progress in reducing the burden of malaria, particularly in children. We know that this week has been a landmark week in the beginning of the large pilot demonstration projects of the TSS vaccine, the first malaria vaccine to make it into a general population, with the introduction first in Malawi and then subsequently in Kenya and Ghana. This is really a remarkable event that this vaccine has gotten this far. Oh, it's been a long road to get this vaccine to this point, but it's a really exciting time because now we have an additional tool in our fight against malaria. We also know that there are many challenges in reducing the burden of malaria, particularly in sub-Saharan Africa. There's been some stagnation of progress in some parts of sub-Saharan Africa and in some countries. And in fact, even some backsliding in the number of cases and deaths. So we have a large task ahead of us. This symposium is organized in three themes or three sub-themes. We're going to begin with a section on perspectives on malaria elimination, and we're going to hear from colleagues from the World Health Organization, from PATH, and from the Zambia National Malaria Elimination Program. This session will be moderated by Professor Brian Greenwood. We're then going to have a session on challenges to malaria elimination in sub-Saharan Africa. And we're going to hear about the problem of insecticide resistance, the problem of the asymptomatic reservoir, and the challenges posed by population movement that can move parasites across borders and countries. I will be moderating that session. And then our third session in the afternoon will be on novel tools and strategies to try to make progress toward achieving malaria elimination. And we're going to hear about the use of serology and parasite genomics, the use of novel vector control strategies, and modeling strategies. I'm going to conclude this symposium by trying to bring a number of these themes together by talking about some of the work of the Southern and Central Africa ICMR, or International Centers of Excellence for Malaria Research, and some of the work we've been doing in Southern Province Zambia with our collaborators at Macha Research Trust to better understand some of the reasons for low-level transmission in this setting and what it might take to achieve malaria elimination. Each of our speakers will take about 20 minutes to present, and we've allotted about 10 minutes for questions. Our moderators will do our best to keep us on time. We have a very rich and packed agenda. I ask that if you're, during the question session, that you use the microphone. As Dean McKenzie alluded to, we are being live broadcasted, and we want everyone to be able to hear the questions. We're very fortunate today to have as our keynote speaker Dr. Rick Steketee, who is the U.S. Global Coordinator for Global Malaria Coordinator for the President's Malaria Initiative. And Rick will be talking about the steps to malaria elimination in Africa, in sub-Saharan Africa. We have 2 breaks, a morning break and an afternoon break. We'll allot approximately a half hour for those, but we may shorten those if we're falling behind on time and need to catch up. And then we have a lunch session from 12:45 to 2. I encourage you all to obviously talk to one another. That's one of the great strengths of these kinds of symposia, but also to look at the posters. We have 2 poster sessions. We had to divide it into 2, so we have 1 poster session at lunchtime, and then we'll have a second poster session from 5:30 to 6:30 when we have our reception over in Finestone Hall. We've had more than 400 people register for this symposium. We have 54 posters that will be presented, and we have a number of our colleagues, as I said, joining us through the webcast. I'm going to, again, welcome all of you to this very exciting symposium on malaria elimination in Africa.